Clarence is from Tennessee. He's a bi-generational father who has 4 children. He's a Navy vet and is the 2014 Peer Specialist of the Year. When I asked him what type of introduction he wanted and what was something that he wished people put more focus on when introducing him, he said his family, and that moved me. It's always great to see people come back to their roots and humble themselves and say, this is my pride and joy. In combination of both his personal lived experience and professional career, Clarence has over 30 years of experience with the mental health system. Over that time, his greatest joy of seeing change was the shift in dynamic between professional and consumer or client relations, seeing that equal and shared power over that time. That's not to say that Clarence doesn't see more work that needs to be done. Specifically, he spoke to me about the stigma that is still surrounding mental health and how we have to continue to battle that stigma in order for true system integration and true change to happen. I told Clarence this was a mixed audience. I don't know that the partnership staff let him know that there would be some young people here that might have sprung that one on him. And when I told him that, I said, what's something that you would tell yourself if you were 30 years ago when you were first starting out and back in those young people's shoes? And he said, you don't always get your way, life isn't fair, and shit happens. I've never related more to a system partner than when he said that. To take that a step further, I said, well, what's one message you would want to bring to those youth who are sitting in this room? And he said, you don't always get your way, life isn't fair, and shit happens. Clarence, I'm very excited you could join us today, and I'm very excited to hear you speak. If everybody could welcome you to the stage.
Good afternoon, everyone.
Good afternoon.
Alex, you have some future in this business. I can't tell you how excited I am to be here today, and I was asking one of my friends and colleagues whom I've known for some time, how long have I been doing this? How long have I been coming to Pennsylvania? And she says 5 years. And I believe that's as long as you've had this system of care grant. So I feel like I'm a part of your success. And it's your success that I want to speak with you about just briefly this afternoon. Before I do, I think it's only customary that we acknowledge appreciation for those who brought us here. And so with that, I extend my deepest thanks and appreciations to Crystal, whom I've not met. Crystal, wherever you are. There you are, Crystal. You have 2 Michelles, both of whom are very darling, and I must say I would feel like the tired person I am if it had not been for Michelle and Michelle. So Michelle and Michelle, thank you so much. Certainly would like to acknowledge and express my appreciation to the Pennsylvania Families Incorporated, the statewide family network, the Youth and Family Training Institute, and the Pennsylvania State Leadership and Management Team. My deepest appreciation and thanks to you all. I've been on one single quest since I've been here, since arriving at this delightful airport of yours. I love the interior decorating. But the question has been, why do they call this Happy Valley? Anybody know? Anybody? Well, I tell you, I'm not one to begin a bit of research and not find some answers. Here's what I found out. You had here at the university an associate dean of liberal arts by the name of Pat O'Brien. Now, we don't know what Pat was thinking about, but it was Pat who gave this community the name of Happy Valley. What he was drinking, what he was smoking, I don't know. But Pat was obviously happy. The one that I really appreciate and that resonated with me was a sports analogy. It seemed that your favorite hometown team, the Nittany Lions, was in a tough battle, and as a matter of fact, they were behind going into the fourth quarter. The arch rival is unknown, but apparently Penn State pulled it out in the closing seconds of that game. And the sports announcer proclaimed, it's going to be a happy day in the Valley tonight. And so with that stuck Happy Valley. Again, I don't know about you, but I like the latter. As a matter of fact, overcoming adversity and moving forward and coming out with the victory, being resilient, is as good as it gets. And I think with that, we can all proclaim, those of you who sit here today, that it's going to be a happy valley tonight. I really enjoy and I appreciate the title of this year's conference, Strengthening Partnerships Through Sustained Change. How very, very appropriate. Someone's been reading the headlines. Obviously, someone's very in touch with the state of care here in this country. It is exactly about that. And the change, I don't think, is more evident than with regard to the outcomes that we all look forward to. In economic terms, the cycle of poverty is the set of factors or events by which poverty once started is likely to continue unless there is outside intervention. People with mental health, substance abuse, and physical health challenges represent a large portion of individuals being in chronic poverty. The implementation of the Affordable Care Act, I don't care if you're red or blue, and the health activated advocacy, the integrated health community, an exceptional opportunity has presented an exceptional opportunity to provide that outside intervention. Well, what do you mean by that, Clarence? Well, that's a good question. I'm glad you asked. Simply put, we're in a time of our lives, guys. It don't get any better than where we are right now, Alex. If I were launching a campaign, if I were going into battle again, these are the ideal conditions I would wish to enter that campaign on. And in warfare, like advocacy, either superior numbers or superior firepower will prevail. I say to you, partnership, based on what I've seen nationally, you have not only superior firepower, but you have superior numbers. And for that, I think you owe one another acknowledgement and appreciation. So if you're sitting next to someone who falls within the realm somewhere of this partnership, be member, parent, provider, state worker, lean over to that individual and say to them, "You're the best partner I've had other than my spouse." I can see that a lot of people really mean it. I can see that a lot of people really mean it. And some, like we sometimes do, are just faking it. But that's okay. It's all right to fake it till you make it. A significant emotional event will strike you one day. One of the things that Alex did not tell you, and that was, "Well, Clarence, 30 years, aren't you tired?" Not even. I'm more inspired, more invigorated than I've ever been. Because what I learned 30 years ago was a secret to life. You see, I think we all, sometime or another in our lives, if we're faced with severe enough challenge, we'll ask ourselves, why me? Anybody not ask yourself that? Why me? Oftentimes we're not ready for the answer. And the answer that I got that night was, why not you? Would you rather we visit this on your brother, your sister, your mom, your children, your husband, your wife? Why not you? You see, the voice, the answer that spoke to me that night, the King of Kings, when he lifted me off the floor, said to me, "Clarence, I've always been with you. I was with you the day that you eluded the Klan down in Mississippi. I was with you when you took your tumble off that motorcycle that you shouldn't have been on. I was with you when you soloed World's Finest Navy. I was with you with the birth of your first child. I've been with you through most and all significant challenges and celebrations of your life. How dare you ask the question, why you? Why not you? Why not you, partnership?" The celebrations we have today will give way to the challenges we'll face tomorrow. One thing I know about the political climate in this country is that there are no pat answers. The governor over in Virginia is warring with his legislative bodies, trying to decide whether or not he should go it alone and expand his Medicaid service contract on his own. The legislator is saying to him, "Not without a fight." Colorado can't make up its mind whether or not the Affordable Care Act is saving its money or spending its money. You ask two providers the same question, you'll likely get two different answers. We lost the fight out of New Mexico to have disclosure made of what providers, major providers, or I should say insurance companies, pay their providers. It failed because the major insurance company in the state, Blue Cross Blue Shield, had more influence. And I said, no way. No way will we disclose that. Sets the ground and framework for which the challenges we will see tomorrow. Decisions are still being made with regard to whether or not we're going to expand Medicare and Medicaid. Decisions are still being made with regard to whether or not ACA saves us money or costs us money. Decisions are still being made with respect to disclosure by insurance companies with regard to contractual obligations and requirements that they have. Despite all, there are some things that we know for certain. Health services are increasing by being delivered in integrated systems of care. And team-based provider systems are increasing in numbers. Care for behavioral health conditions are increasingly being coordinated in integrated care settings, primarily through primary care physicians. Medicaid and Medicare are expanding to use the managed care model to improve quality and control cost. Over time, commercial, state insurance, Medicaid, Medicare plans will all have the same look and feel. Models of reimbursement. Models of reimbursement are shifting to population-based outcomes and risk. I think that's the most significant. I think that's the most significant. And I think it's where you have your greatest capacity. Because what are outcomes? What should those outcomes be? Well, I have my own perspective. I can tell you truthfully that with me, it was an employment opportunity. Had it not been for a job, I would have not been able to afford independent housing. If it hadn't been for independent housing, I would not have been able to affect home community-based care. And without that home and community-based care, I would not have been able to pursue the goals, aspirations, and ambitions that I carry with me today. You'll hear a lot about employment first. You'll hear a lot about supported employment. You hear a lot about organizations and programs that are geared to stem the tide from being in a youth system of care to adult system of care. That should not be an automatic response. That should not be an inevitable path for individuals who battle with these conditions in their youth. When I was as young as Alex and many of others in this room, I had dreams, aspirations, and hopes. And I hope those of you who are sitting in this room of that age still have dreams, aspirations, and hopes. And I pray that you see a career and an opportunity to support yourself and family as being a major goal that you pursue. I believe that as we've transformed this system of care, more and more reimbursements will be based on these types of outcomes. So once again, I applaud you, Pennsylvania, system of care, 13 and counting. Somebody told me next year you're going to have the whole state. It can happen. It can happen. Because one thing I've learned about you in the 5 years that I've been coming here is that you have answers that everybody else keeps struggling with. You've overcome some of the challenges that a lot of others still face. Here you are sitting in a room of recipients of care, family members of those individuals, providers, advocates, state folk. Not even in my state of Tennessee have we been able to do this on a consistent basis with this many folk in the room. I don't say that because I have some great influence or power in the state of Tennessee. I like to think I have. But guess what? I've never spoken to an audience like this in Tennessee. Some people have difficulty with the truth. Some people have difficulty with embracing and accepting our own responsibility. And in many, many states, they're still doing this, pointing the finger. They're still looking for ways out and around what sits and stands right in front of them. They're still looking and hoping that some law is going to happen where individuals who live with these conditions are somehow or another herded back into the darkness. Pennsylvania, you said that ain't going to happen. Not on my watch. And I'm proud to be with you and stand with the systems of care. Hold your hand in partnership and say, right on. It will never happen on our watch. I applaud your success. I encourage you to continue working hard, and most importantly, together, to continue to deliver on the types of outcomes that matter not only to myself, but to Alex and to all his friends sitting in this room. Thanks again, Partnership, for inviting me. It's always a pleasure. Anytime, anything I can do, I will come. Thanks again.